Okay, thank you so much. Scheduled to stand here are not our old friends, but we just met before on internet. So this is the first time face-to-face. We have 6 experts share a lot of application about HIFU. So I just gave a simple overview of application of HIFU and share the training experience in China. Because I think most of us will stay together for the next 2 weeks. So here is my speech. We all know that the surgery evolution for almost 200 years, from the traditional open surgery to laparoscopic surgery and to HIFU. We can see the difference. We can see the difference is very big here. First, we can see the skin. The skin condition is so different. For traditional open surgery, we can see a big scars on the skin. And for the laparoscopic surgery, there are small holes. But for HIFU, the skin, the abdominal wall is very smooth. But for the uterus, for the organs, the damage, no matter the myomectomy or laparoscopic surgery, the scars, the damage to the uterus is very big. But for HIFU, the uterus is totally no damage here. The principle of HIFU I have talked about before, so I don't talk it here. For the HIFU treatments, the most characteristic is that is the 3D dimensional, and we can just move the transducer and set the focus point to the target region and increase the temperature and cause the tissue necrosis. So I will talk about the most of the application about HIFU. The first case we treated is in 1997. Is a 10-year-old boy with osteocarcinoma. We can see here is the before HIFU and after HIFU. We can see here is different. So now the HIFU knife made from Chongqing used over the worldwide and about 30 countries here. And for the application of HIFU, we can see the indications we can describe just like this. The first one is benign and malignant tumor, and the second is solid tumor. So that means we can do all these solid tumors, no matter it's benign or malignant. So now we use this technique in uterus, breast, liver, pancreas, kidney, bone, soft tissues, and others. For cardiology, it's the most we use is most wide now. We can treat fibrosis and hemolysis, placenta and creta, CSP, and so on. So first, I will talk about the HIFU ablation for liver. Totally, we can describe just like this. We can treat primary liver cancer, that means HCC, and also we can treat metastatic liver cancer. So for primary liver cancer, we can treat the local radical treatment for small liver cancer. We can treat this, and for the big one, for the big HCC, we can combine with TIS. And for the metastatic liver, we can especially treat the needle implanted liver cancer. This is a great advantage of this technique. And also we can treat other metastatic liver cancer here. So the advantages of HIFU treatment for liver cancer is that we can treat the cancer in difficult position and the cancer liver main blood vessels. And we can also treat tumors in pathway. Treat multiple lesions at one time. Professor Hemin just showed us a lot of excellent cases here. And also, we can treat the patient repeatedly. So for the indications, divided from our treatment purpose, we can divide into curative treatment and palliative treatment here. So this case we just saw before. 3 years, there is no tumor here. And for the metastatic, especially have multiple targets here, we can treat it. So we have a lot of research before for the tumors adjacent to the major blood vessel and also in difficult locations. So for example, just like this one, this is a very big tumor here. And we can see it's big and vasculate. So before HIFU, we combined with TIS. And after TIS, we can see there's still some tissues with contrast on MRI. And then after TIS, we combined with HIFU. We can see all of the tumors are ablated. And this is a 52-year-old patient with liver cancer. And before HIFU, he took 3 times of treatment, but because the tumor is close to IVC, so there is some tumor tissue still here. So we give him HIFU ablation. We can see the blood vessel is very complete. And this one, Hemin just showed us. And also, we can treat the metastatic liver cancer or the can't for the section word radiofrequency ablation. So we have a good results here. And for this one is our metastatic liver cancer with 2 big tumor on the left liver and the right one. And after TIS, 2 weeks after HIFU. So other application is for pancreatic cancer. So the purpose of HIFU treatment is to relieve clinic symptoms and improve the quality of life. And the second purpose is reduce tumor load and increase chemotherapy sensitivity. And the third purpose is to reduce tumor stage, and maybe we can create conditions for radical surgery. So this is our early research from Professor Wu Feng. So this improves that HIFU is safe and favorable method for the treatment of advanced pancreatic cancer. And this research is from Korean studies. And this is for stage 3 and stage 4 cancer. We can see this is safety and increase the quality of life and the limb ratio. For these 2 cases is from this article. And the pancreas cancer, 2 of this one is around with vessels. So, but we can treat it and have a good results. We all know that for cancers, we need to make MDT. So sometimes the pancreas cancer is not sensitive to chemo or radiotherapy, but we can combine radiotherapy or chemo and with HIFU. And we can see this combined treatments can relieve the pain very immediately after HIFU. So this is very good for the advanced pancreas cancer. And this is a research from Bonn, University of Bonn, for the advanced stage pancreas cancer. And we can see that this is the volume of the cancer. Is shrinkage from during our follow-up, 1 week, 6 weeks, and 3 months, and 6 months. We can see this never stage 3 or stage 4, the volume shrinkage very good. And this is for the pain relief. For the pain relief, we can say almost 50% of patients after 6 months follow-up, they don't need any painkiller. And this is a 68-year-old patient that he couldn't tolerate surgery or chemotherapy. We can see before the first time, before HIFU, there is the tumor here, and here is 1 day after. And we can see and 6 months after, we can see that the tumor little grows, and also the CA199 was increased. So we give him a secondary HIFU treatment here, and we can see the CA199 decreased very fast. So that means we can use this technology for the treatment for the cancer. And pain score, the painkiller, we can see that after HIFU, we know that for advanced pancreatic cancer patients, always has serious pain. But after HIFU, we can see the score decreased. Before HIFU is 4.49, and 1 week later, it's only 2.65. So it's very impressive. And this is one of the patients from Chongqing. She is a 61-year-old female, and her cancer just recurred 7 months after surgery, and so she came back. She came back, and we gave her HIFU combined chemotherapy, and we follow up. For this is during the HIFU treatments, and for this patient, she lived the survival time after HIFU was 24 months, and the cognitive survival time after diagnosis was 32 months. For bone tumor, we can trace primary and metastasis. So for this one is a 21-year-old man with osteocarcinoma. And this is before HIFU. We can see here is the abnormal area. And the 24 months we can see here show the repair of the bone tissue. And this one is the 18-year-old woman for underwent HIFU treatments. And this is before we can see the tumors all around, and 2 weeks later, 3 weeks later. Also, we can treat metastatic bone cancer here. We can see before HIFU and after HIFU. And HIFU ablation for breast, we can treat breast cancer and breast fibroma, especially for multiple one and small one. This is a contrast MRI for a 39-year-old patient. Here is before HIFU, and this is after HIFU. 2 weeks. We also have published a lot of research in the archive show that HIFU treatment for the breast cancer is feasibility and safety. HIFU ablation for kidney also are very good indication. For this patient, he only had 1 kidney, but here is also we can see the tumors here, and after HIFU, there is no blood supply here. For this patient has the tumor occurred in 2 kidneys, so we treated with HIFU 1 by 1. And from China, we have seen some clinical trials here. For this one is from Suiling. They treated the recurrence of ovarian cancer and metastatic pelvic tumors. We know that the recurrence of cancer is always, most of the patients are not so sensitive for chemotherapy or is not have no conditions to surgery. So we combine with HIFU. We just treat the solid part and we combine with chemo. So we found that the tumor just shrinkage and the pelvic, the pain is relief. And this one is the first one for the recurrent cervix cancer. We treated in September. Professor Chen Wenzi just before for this patient, we just gave her HIFU treatment before surgery, and after HIFU 3 days after HIFU, we just do some surgery, and this is improve the this is just decrease the bleeding and shorten the surgery time. So this is my first one. This is the first one. Okay, we talk about for the benign. Okay, there is uterine fibroids. So what kind of uterine fibroids we can treat? We can talk about this in two sides. The first one is we talked about the technical indications. That means we can see the nails, we can see the fibroids on the ultrasonography very clearly. And the second one is then there is a safe acoustic pathway. This is technical indications. And the second one, we talk about the clinical indications. So the patients with clinical symptoms, we can treat this. I think there is no doubt. And but we know from our clinic work, we meet a lot of patients. Maybe they don't have any clinical symptoms, but they, with strong treatment intention, will have serious psychological failure. So for these kinds of patients, we can treat. So also, the uterine fibers, the HIFU treatment for uterine fibers have got into a lot of international guidelines here. So I'll show you some cases about the evaluation after HIFU treatment. For this one is for this one here, we can see the uterus, the fibers is just in the post wall, and 2 weeks after HIFU, we can know there is no blood supply here, and 4.5 months the uterus just shrinkage, and 10 months is smaller. Okay, and for this is another one, almost 6 centimeter about the fibers, and before HIFU and during our follow-up time, 8 months later, we see only our little bump here. So the uterus is almost normal. So maybe we for the thick one, for the big one, maybe for our doctors, it's very simple to do surgery or do myomectomy. But for this one, this kind, we can see much one.